Tell me when you're ready. Knock, knock. Hi, Ms. Jones. My name is Jennifer. I'm going to be your CNA today. I'm going to measure and record the contents of your urinary drainage bag. I'm going to wash my hands and get my supplies. Washing my hands. I'm going to close your curtain. Okay, some of the things I need to do is I'm going to put a barrier on my countertop, and I'm going to put barriers on the floor so that my graduate is not on the bare surface. I need alcohol pad, I need gloves, and I need my graduate. Make sure you don't touch the inside of your graduate at any time. It's an infection control issue. I like to get my alcohol pad open and ready. Have my gloves. And I'm going to raise the level of the bed so I can aim the catheter tubing. Make sure if you're raising the level of the bed that you move the table so you don't injure your patient. You're not being evaluated on moving the table around the room, but you are evaluated if you do something to injure the patient, and the table can do that. And I should have asked, I should have verified that she's not too close to the edge of the bed before I raise the level of the bed. And then now that I'm finished moving the level of the bed, I still verify that my patient is not too close to the edge. Okay, so I'm going to remove my tubing from its home. Make sure I'm aiming. Even though my catheter has just got a couple of drops of fluid coming from it, you don't have to sit there and shake it. Please don't do that, because that opens up a whole nother can of issues. Clean it, put it back in its house. You're going to set your graduate on a flat surface. Make sure you bend over to read the contents, to measure it. Don't measure it from up here because it's not an accurate reading. So I get 275. I'm going to pour the contents in my toilet. Make sure you're not doing this or resting it. Make sure you're up high enough so they don't think that you're pouring it out, touching the surface of the toilet. Rinse it. You have to make sure that your items that were wet at one point or another, that they're completely dry before you put them away. Close the lid. Okay. And take my gloves off properly. Make sure you do that every time. Wash my hands. Now is the point that I would write down the contents of what was in the bag. So I would write that it's urine, the correct time, don't make up a time, and the amount was 325 mLs. And I'm done with that. Now I'm going to lower my patient's bed. The key is to not write down anything using dirty gloves, contaminated gloves. You can do what you want all day long with clean gloves before you start doing patient care, but don't write it down with dirty gloves. Before I move the level of the bed, I'm making a correction. I should have made sure my patient is not too close to the edge. Ms. Jones, would you prefer the table over you or next to you? Over you? Okay. Here's your call light. Would you prefer a magazine or a newspaper? Magazine, okay. Gonna open open my curtain using a barrier. Oh, one thing I did not do, I need to check the tubing for kinks. So I'm just gonna lift up the sheet. There's no kinks. I feel like I need to wash my hands again. Washing my hands. Okay, she has her call light. I recorded the catheter contents. The catheter bag is not on the floor. That's another checkpoint. I checked the tubing. I made sure that my patient was not too close to the edge of the bed at any time that I moved the level of the bed. I'm done.